International doctors from across the Pacific are gathering on Kaurna country in Adelaide to discuss how to make healthcare more culturally appropriate. Issues of language, customs and collaboration with Western medical doctors are at the forefront of the talks. Kaurna and Narungaman and President of the Australian Indigenous Doctors Association, Dr Jonathan Newchurch, joins us now from the conference. Good morning, welcome to the program.
Good morning, Dan. Thanks for having me on.
Tell me, how is it going, and what have you heard so far?
It's going great so far. You know, we've got nearly 800 delegates from around the Pacific in Adelaide to talk about our theme for this year, which is Naluku Wara, Naluku Tapupurana, Naluku Purana, which in Kaurna translates into English as our language, our culture, our health. So we're having great discussions around how this is actually intrinsic in us as Indigenous people and how that is woven into how we do what we need to do to improve the health of our people.
And for anyone who's not familiar, when you say that that's intrinsic for health, can you explain that a little bit more?
Yeah, so we know within ourselves as Indigenous people that, you know, we need our language to be able to do what we do as a people. It's how we do our culture, it's how we communicate, it's how we do our cultural customs. And so when we have this missing, we get into a state of dis-ease. And so this is part of the health disparity between Indigenous and non-Indigenous people. And so what we're seeing now is that this is actually being reflected in research and literature that shows a measurable and significant impact on not having your language and how that impacts your health and how having your language and cultural practices improves your health.
And why is that? What is that link there that you mentioning has been explored in research about connection to country, connection to language and the health benefits and implications from that?
Yeah, it really gets back to having that language which is connected to everything that we do in life. It's connected to how we speak to each other. It's connected to what we call all the things in the world around us, and then how we go about our cultural customs, our ceremonies, and how we interact as a people. Because language really demonstrates how that people or culture thinks and does things. And so when that is removed from a person and you're put into a foreign language and foreign system, then you're out of place. And when you're out of place, you get into this state of dis-ease, and this is where we see the disparities in our health.
And have you, at this conference, been hearing of parallels from the Australian experience to those from more broadly around our region?
Yeah, definitely. And, you know, it's an unfortunate reality that, you know, the shared history of colonisation, we have a shared experience of how that happened and the devastating outcomes that are now borne out in the disparities in our health, and why there are so many close the gap targets that we need to address.
And what happens from here with this conference? What will be the focus for the remainder of it, and then where to after that?
Yeah, so we're still just having those rich discussions from all of the different people from around the Pacific about their experience, their culture, and how that's been affected, and how they are trying to change that so that they can improve the health of their people. And so then we are sharing knowledge between each other so that we can then take that learnings and the collaboration to then go back to our communities to improve the health of our people.
And just finally, I guess, what can come from this when it comes to working within mainstream health services with a focus on First Nations health?
Yeah, so as an Indigenous person, or any person really, you need to have the health services reflect you. So you need to have people that look like you, speak like you, act like you in those health services for it to be culturally safe. You need to have the language that is used in those health services conducive to how that Indigenous population speaks, and you need to have the infrastructure and the things in there that reflect those people. So whether it be signs, art, those things matter. We know they matter, and if they're not there, then people don't feel safe to go to those health services to engage and really get the health that they need by collaborating with the health services.
Kaurna and Narungaman and President of the Australian Indigenous Doctors Association, Dr. Jonathan Newchurch, thanks very much. Good luck with the rest of the conference.
Natalia, thank you.